Well, let's look back. The current outbreak of monkeypox was identified with 20 cases recorded in Britain in May. Since then, it has grown to around 16,000 cases across 75 countries. And of course, we are included in that with 3 cases. The National Institute for Communicable Diseases Executive Director, Professor Adrian Puren, joins us now. Professor, thank you for being with us. How serious is this a public health emergency of international concern? It is the highest level of alert, but apparently the head of the WHO said he was choosing that alert level despite a lack of consensus. What does it mean?
Yeah, so in fact, I think it was about 3 weeks ago that in fact they had their first discussions around whether to call this a PHEIC. And I think it was a wait and see. And I know that there was controversy around that particular decision. I think this decision is really based again on the fact that there are continued transmissions occurring in a larger number of countries and a number of cases. And a PHC is not really, I think, taken lightly. And I think it's the position similar to COVID is really to galvanize a united approach to this because it affects multiple countries. It's transmitted and imported in multiple countries. The importations are likely to explain the cases that we have in our country as well. So I think the purpose of a PHEIC is really, as I said, to coordinate activities and to inform the public, inform public health workers and other health workers about what this particular disease is all about. And of course, to really ensure that we are ready, similar to what has happened with regard to COVID. I know that there are controversies around some of that, but really it's around access to appropriate guidelines, access to diagnostics, vaccines, and medication as well. So that's really one of the major purposes, given the nature of this particular spread. I think we did not expect to see such a large spread outside of a zoonotic spread that we have certainly seen in Africa for so long. We have certainly had smaller numbers of cases and clusters, but in this particular instance, we're seeing that the numbers of cases outside of a zoonotic spread are quite dramatic. Of course, it's very different to COVID. It's a different virus. It spreads differently. It has a longer incubation period. It really requires close skin contact, for example. I think the respiratory droplet matter is not the major route. I think it's really the skin-to-skin contact that's important, as well as exposure to, for example, fomites or surfaces and bed linen and so forth that leads to this particular spread. I think it's unpleasant for those individuals who have it in terms of the types of lesions. And again, transmission really only stops, I think, once the skin has healed. So again, isolation becomes really critical, and that can be very difficult, as we've seen with COVID-19, for example. So these are the sort of considerations why a PHC does certainly add a voice, if you like, to how we should be approaching this particular current outbreak.
And the recovery rate is high. So what would you say to people who are concerned or want to know exactly what symptoms they should keep an eye out for?
Yeah, so South Africa has done a risk assessment. I think this is about 2 weeks or so. So I think for the general population, the risk is low. It's really only when you start experiencing what we call a prodrome, a series of symptoms such as, for example, a marked high fever, for example, headache, muscle pain, or tiredness and weakness, and so forth. And this is followed in about 3 days or so with the appearance of a rash. And again, the rash distribution varies. In fact, in this particular outbreak, again, it's really clear that, in fact, the rash may even precede the appearance of this particular prodrome. So I think it's really the awareness of those particular appearances of a prodrome followed by rash, or vice versa, that those individuals then need to seek attention in terms of a diagnosis. And again, there's a differential diagnosis. And this is then followed by a PCR test, as it's called, followed by isolation and contact tracing. That'll be the key steps, at least now, for South Africa. So I think the general population should inform itself. I think that's critical. That's why we need to speak to the public and be aware and make people aware. But I think not to get to the state of panic at all. Again, this is a very different disease. We do not expect to see the numbers that we've seen with COVID-19 and the management, although it has similarities. is again very different.
The WHO says this is an outbreak that is concentrated amongst men who have sex with men, especially those with multiple partners, saying because it can be linked mainly to that group, it can be stopped with the right sort of strategies, communication strategies. But of course, then on the flip side, there's that danger of stigmatization around this disease. And as you've said, it's not transmitted only through sex.
Absolutely. So I think this is very important. And I think that's why, again, as I said, the PHC certainly adds a voice in terms of making sure that governments are able to target the appropriate communities to make them aware, especially in high-risk settings, what the risks are and how to manage those risks, and to create an environment where people do feel that they can actually present. I mean, we've diagnosed 3 cases, but the likelihood is that there may be well more cases. And if we continue to stigmatize individuals, regardless of what their orientation is, that will make it really difficult. But again, I think we just need to be cautious that even though we've seen what has happened in Europe, situations in South Africa could well be different. And again, the exposures may well be different. And I think it's important that it can happen in families, it can happen in pregnant females, in young children, where the disease outcomes are really poorer. So it's really critical that we as a public make ourselves aware, do not stigmatize, create an environment where people who maybe experience those particular symptoms get the opportunities to present and get diagnosed, and the appropriate measures are certainly introduced. So it's really critical that the government now really focuses on its communications with the broader public in South Africa and key groups within South Africa.
All right, thank you for that. Professor Adrian Puren from the National Institute for Communicable Diseases. He is Executive Director.